123 en français, 613-233-1979 et le code c'est 5490123. To get started, we're going to hear a quick update from our panelists, followed by questions and answers from you, the members of the Ottawa community. Joining us today are Councillor Keith Eglai, Chair of the Ottawa Public Health, who is on the phone line, City Manager Steve Kanalakis, Dr. Vera Etches, Ottawa's Medical Officer of Health, Anthony DeMonte, General Manager of Emergency and Protective Services, and Ottawa Police Chief Peter Slowly. I'd like to thank our panel members and their teams for their leadership during this very difficult time. I also want to take a moment to acknowledge our city's nurses as we celebrate National Nurses Week. J'aimerais prendre un moment pour reconnaître les infirmières et infirmières cette semaine. Merci de votre dévouement, non seulement aujourd'hui.
Thank you so much for your devotion, not only today, but every day.
Nurses who are true heroes, not only during the pandemic, but every single day. I'd also like to give a special thank you to Prime Minister Trudeau, who visited nurses at OPH in Nepean, Constellation Building, this afternoon to thank them for all the work they've done in helping to flatten the curve. We're slowly starting to see a decrease in the number of cases of COVID-19 across the province, and we're hopeful that this trend will continue and will lead to the gradual easing of some restrictions that have been in place. We've recently taken some positive steps in our city. Nous avons récemment pris des pas positifs dans notre ville. Community gardens opened almost 1 week ago. And also last week, it was welcome news to many residents when City relaxed some of the park restrictions. This has provided an outlet for many people and families to escape the confinements of home, to get some fresh air and burn off some energy. Today, Premier Ford, just basically an hour ago, announced that some restrictions will be lifted in the coming days. On Saturday at 12:01 a.m., golf courses, marinas, boat clubs, and boat launches will be able to open. On Tuesday at 12:01 a.m., we'll see even further restrictions lifted. Retail stores with on-street entrances can reopen, certain health and medical services may resume, and there'll be lifting of essential workplace limits on construction. This is news that many of us have been waiting to hear. C'est certainement des nouvelles qui plusieurs attendaient à attendre avec impatience. We must remember, though, that COVID-19 is still prevalent in our community, and we cannot let our guard down. We still need to continue to practice physical distancing in order to keep our community safe and healthy. As Dr. Etches wrote in today's Ottawa Citizen, quote, Ottawa must continue to keep this virus pinned down. Now, as we move forward with a cautious approach to reopening workplaces outlined by the province, more Ottawa businesses are returning from a period of uncertainty. Supporting our local and small business community is an important part of Ottawa's economic recovery. Our economic health is linked hand in hand with the health of our economy and our community. I want to thank residents for continuing to support local businesses during this challenging time. J'aimerais remercier les résidents qui continuent à appuyer les entreprises locales lors de cette période très difficile. We know that these challenges, you'll likely have more questions. You're calling 311, Ottawa Public Health, or reaching out to your local city councillor for answers. We're here today to help answer some of these questions, as well as others you bring forward during this town hall. We'll do our very best to get all of your questions today in the amount of time we have. I'd like to now invite Councillor Keith Eglai, Chair of the Ottawa Board of Health, to say a few words. Councillor.
Thank you, Mr. Mayor. Hello, good afternoon, Quay. I'd like to also reiterate what the Mayor had to say and thank the Prime Minister for his visit today and thank the Premier for his recent announcements. Both the federal and provincial governments have been such excellent partners going through everything that our city has gone through over the last number of weeks and months. So much appreciated. I'd like to begin my remarks by acknowledging all the nurses who have dedicated their careers to helping others. Not only does this week mark National Nurses Week, but 2020 marks the Year of the Nurse and the Midwife. I can't think of a more appropriate time to dedicate a year to such outstanding healthcare professionals. The first few months of 2020 have highlighted how important our nurses and healthcare workers are and the value of the work that they perform. Thank you so much for all that you do. Many of these incredible nurses work in our long-term care facilities. I recognize how difficult the situation is in these settings and how critical and potentially challenging the work is. The nurses and staff employed in these homes take care of our loved ones and are responsible for some of our most vulnerable community members. I want to express that all long-term care facility staff have our support and our thanks. The work that you do ensuring that our loved ones are safe and well cared for is appreciated more than you can possibly know. I also want to encourage the use of non-medical masks and face coverings. Although wearing a non-medical mask is not a replacement for physical distancing, hand washing, and monitoring your health, they are an added resource in our fight against COVID-19. Until a vaccine becomes available, masks can play a role in slowing the spread of infection. If you are ill or if you are asymptomatic or pre-symptomatic, wearing a non-medical mask or face covering protects others from your respiratory secretions, therefore preventing the potential spread of the infection. Your mask protects me, my mask protects you, and as such, someone wearing a mask is sending a signal that they care about your health. Ottawa Public Health and I have been working hard at promoting the use of non-medical masks when in situations where maintaining physical distancing is challenging. I want to thank everyone who has already begun using this additional resource. Lastly, although it may not have seemed like it this week with the cold, summer is on its way. This long weekend will hopefully bring some nice weather so that we can finally get out and enjoy some much-needed sun. I encourage you to get outside and take advantage of the nice weather that's hopefully to come. I just want to ensure that it is done safely. We've worked so hard to get where we are, and the measures that we have adopted are truly working at limiting COVID-19 spread. Now is not the time to let our guard down. We're doing incredibly well, so let's please keep it up. Remember, we're in this together. Thank you.
Thank you. Merci beaucoup, Chair Eglai. And now we'll hear from our City Manager, Steve Kanellakis.
Thank you, Mayor Watson. Bon après-midi, tout le monde. At the end of last month, the Government of Ontario unveiled their high-level framework for reopening the province, and they recently extended their state of emergency until June 2nd. Extending the state of emergency means all enhanced public health measures, including recommendations to stay home, practice physical distancing, and hand washing, remain in place to stop the spread of the virus. We know that the province has taken a careful, stage-by-stage approach to gradually loosen emergency measures as they move to reopen Ontario's economy. The City of Ottawa remains in active emergency operations and is in lockstep with the province in terms of our plans to reopen as we continue to address immediate and evolving community needs due to the pandemic. Yesterday at Council, I presented an update on the City's response to COVID-19 and identified emerging issues and key initiatives moving forward. In terms of our recovery plan, we are progressing at the pace we can based on provincial and public health direction. We know that this pandemic will continue to impact every aspect of our daily lives for the foreseeable future. So we are working collaboratively with the provincial and federal governments and various partners to build a gradual multi-stage approach that is focused on the needs of our residents, businesses, services, while keeping public safety at the forefront. Measures being taken to help reopen and support local businesses are directed by the provincial government and guided by leaders of our business community and the work of our Mayor's Economic Recovery Task Force. This is a balancing act to reopen some businesses, services, and facilities and relax some restrictions on outdoor spaces while continuing to protect public health. While following provincial orders during the state of emergency, the City has relaxed some of its park regulations to provide residents with more access to our green spaces. And today, Premier Ford provided more details about the process of opening workplaces and getting people back to work. We are taking our cues from the province and refining our recovery plan to respond and adapt to these new announcements and directives. Our Human Needs Task Team continues to actively respond to the emerging needs of the most vulnerable in our community. Service level increases in the social services sector include the delivery of emergency childcare, a focus on immediate shelter and homelessness needs, and enhanced infection control practices in our operations and services. Additional staff time, supplies, monitoring, and testing in our long-term care homes continues to enhance infection control practices, as well as restricting staff to work for one health service provider as per provincial directives. We also developed a partnership with local institutions for the recruitment of healthcare students, and we redeployed city staff to promote the social and physical well-being of our long-term residents. We're engaging with the social services sector to determine longer-term needs to resume services as part of the recovery efforts. In terms of our services, we're developing staffing plans and service delivery modifications to support the reopening of priority service areas in accordance with the province and public health guidelines. We're assessing city facilities for retrofits in accordance with public health guidelines to keep staff and residents safe upon reopening, including physical distancing markers, physical barriers, sneeze guards, floor decals, and signage. We're also focused on our economic recovery efforts by working closely with the business community and taking steps to address significant funding gaps and manage the city's finances. I'll conclude by saying once again that our reopening efforts must be aligned to the province and the advice and guidance of our public health officials. Not everything can come back online at once, and we must ensure we have all the measures in place for the services we do bring back to keep you and our staff safe and healthy. I'm committed to listening to the concerns of our residents and doing everything possible to provide the assistance that our staff can provide to the people in need. I want to thank our city staff and our partners for their incredible work under these challenging circumstances, and I want to thank the people of Ottawa for continuing to support one another in this difficult time. Merci beaucoup. Thank you.
Merci, Steve. Thank you, Steve. Now we ask Dr. Vera Etches, our Medical Officer of Health, for her comments.
Thank you. I look forward to the questions. Merci pour votre participation aujourd'hui.
Thank you for your participation today. I'd like to confirm that the number of cases in our community has gone down. Hospitalization are stable.
Community show that cases are declining, although the hospitalization numbers are stable. We continue to have a role in monitoring the effect of COVID-19 on our community, and that is one of the things that will allow us to judge how we're doing with the opening of businesses and the economy. We know that important measures to continue to keep the infection under control do relate to being able to identify cases in our community, and so I was pleased that the assessment centers and the care clinics that are now open to everyone in the population who may have COVID-like symptoms were able to handle additional volume yesterday and today, as anybody is encouraged, if they have symptoms, to be tested for COVID-19 so we can make sure we identify sources of the infection and control outbreaks in the community. Nous avons un rôle avec le...
We have a role to play to follow up with cases and the contacts and their contacts in the community. Also, we continue to prioritize population, disadvantaged population.
Populations that have less advantage, people who are in shelters and other congregate care settings like group homes, to make sure that we can protect people who don't have the same ability to physically distance. So for the whole population, my advice continues to be the same, that the physical distancing is continuing to be required because we have not got rid of the infection. It is helping us keep control. And as we go about more activities, we may be in closer contact with people. And so I am recommending, as our chair said, that people wear a mask when they're within 2 meters of someone else. Alors, continuez avec...
So please maintain a physical distancing and wear a mask when you are very close to another person. Thank you so much. Thank you, Doctor.
Protective Services pour la Ville d'Ottawa.
Merci beaucoup, Monsieur le Maire. The extension of the state of emergency declaration by the provincial government was made to continue to protect the health and safety of the people of Ontario. The City of Ottawa continues to work with Ottawa Public Health, as well as our local, provincial and federal partners, to ensure that the health and safety of our residents is assured. Today, the Premier laid out a plan to lift restrictions on construction and allow the reopening of retail stores that are not in malls, as well as seasonal businesses, pet services, household maintenance, cleaning, and other services. On Saturday, May 16th, private parks, campgrounds, marinas and boat clubs, golf courses and businesses that board animals will be able to open as long as they follow the health guidelines and assure that public health officials have approved them. The City of Ottawa is preparing for the easing of restrictions in the first stage of reopening, and we continue to work with suppliers to secure sufficient inventory for our personnel of medical protective equipment and non-PPE for residents through the services for the residents that we rely on every day. We have implemented screening, cleaning, and disinfection protocols in accordance with public health guidelines. Nous appliquons les protocoles de dépistage.
We are applying disinfection and health guidelines based on the guidelines of OPH.
Train city staff in some of our most popular parks who can provide guidance for Ottawa Park users. We are responding to today's announcement by continuing to promote enhanced public health measures while ensuring safe access to the facilities, amenities, and services identified by the province. The announcement just happened, and the city is looking for some clarification and some of the details over the next few days. Stage 1 of reopening is scheduled to begin on Tuesday, May 19th, with the reopening of retail stores with a street entrance, outdoor sports parks, tennis courts, and off-leash dog parks. Veterinary services, pet services, and household services such as cleaning and maintenance, and health and medical services such as scheduled surgeries, in-person counseling will also be allowed to operate as long as public health guidelines are followed. Businesses should only reopen if they are ready to, and people should maintain physical distancing. In recent days, we've also received questions from residents about beaches and boat launches. The province has just announced that private marinas can resume. However, you cannot still launch from watercraft, including boats or canoes, from a city park. Boat launches and docks at city park areas remain closed as part of the overall closure of the province of park amenities, but if determined by the province, there will be further loosening of restrictions on sports fields and courts currently. Our city manager spoke briefly about the restart phase of the province's framework for reopening and about the work of the Human Needs and Services Recovery Task Forces. In anticipation of provincial directives, we are preparing for the first stage of the opening by identifying operational requirements for additional public works and environmental services. This is for programs including wastewater inspection, repair, preventative maintenance services, and some forestry services, as well as stormwater management and environmental services. Under the Emergency and Protective Services, we're planning the opening of the Spay and Neuter Clinic, property standards, fire and interior building inspections, parking and licensing, and guard services. Stage 1 of the reopening process for the planning and infrastructure economic services will focus on permit approvals, building inspections, leasing, development reviews, planning, surveys, and mapping. And for client services, we will begin the courtroom services at 100 Constellation and marriage licenses as well. All city departments and Ottawa Public Health and Ottawa Police Service are engaged as we plan for this recovery. Tous les services de la ville, de même que
all the city services, including the police service and public health, are engaged in our plan for recovery.
Prepared and ready to respond to the situation as it evolves, and we move forward reopening businesses and reintroducing some of the services we provide. Thank you very much. Merci beaucoup. I look forward to answering any of your questions.
Merci. Thank you, Anthony. And Chief Peter Slowly, our new police chief. Not so new anymore, been on the job for a few months. Chief, thank you for being with us.
Thank you, Mayor Watson. I appreciate it. The new car smell has worn off a little bit, but still feel like I'm enjoying and experiencing all sorts of wonderful things in the city despite the challenges. Good afternoon. Bonjour tout le monde. The Ottawa Police Service continues to provide direct support to Dr. Vera Etches and her amazing Ottawa Public Health team for their leadership of the city's overall COVID-19 response. The OPS is also coordinated with the City of Ottawa on a daily basis at the strategic, operational, and tactical levels. We continue to deliver our policing services and meet the needs of the city and to address public safety issues in all of our neighborhoods. I want to thank the Ottawa Police Service members for their hard work and to the public for its cooperation and support. Calls for service are down 22%, and reported crime has also fallen 23% during this period, but we have seen a steep increase in the complexity and the risk in all calls for service and in all cases of crimes because of the impacts of COVID-19. Reductions in shoplifting have been offset by a rise in doorstep thefts. Reductions in residential break-ins have seen a rise in commercial break-ins. We've seen a significant increase in the number of speeding and stunt driving related excesses on our roadways. This is the #1 reported public safety concern over the past week, and in fact, we have now had to issue almost 600 tickets to speeders in the Ottawa area as part of our Operation Overwatch. Reported sexual assault and child abuse cases are down, but this is very concerning because we believe that COVID-19 has impacted the ability for the city and not-for-profit agencies to identify and report these cases so they can be investigated and/or followed up by the appropriate agencies. We're working very hard with our partners to develop public education and crime prevention campaigns so that people will know that we are still here to help and that you can still reach out for help in these cases of abuse. Shootings in the city are down compared to this time last year, and we've so far seized 43 crime guns. We continue to work very closely with city bylaw officers. Our focus is first and most on community education and engagement to bring about compliance. Despite thousands of interactions under the Emergency Management and Civil Protections Act, at this point so far the OPS has issued only 4 tickets and 4 warnings. With all this, we anticipate that calls for service and crimes will go up, particularly with the restrictions easing and, quite frankly, the better weather returning to the city. We're also looking at other trending public safety issues like hate crimes and hate incidents. These are increasing globally and, of course, locally. We know that these kinds of incidents are happening and they affect us all, regardless of our background. This week, we issued 2 news releases in regards to hate incidents targeting the Asian community. Our concern, quite frankly, is that, again, there's a lack of reporting, underreporting. Through community outreach and community partners, we're working to help the community understand through materials translated in various languages that you can reach out for help if you feel you are the target of these despicable acts. We've been working very proactively and continuously on managing our Ottawa Police Services budget, particularly in light of the projected impacts of COVID-19 on our 2020 finances and beyond. To date, we've made significant reductions and are currently projecting a small deficit, and we will continue to strive to eliminate all such deficits as best as possible. Again, I want to thank you, merci beaucoup, to our OPS members for their ongoing dedication to duty and to our community members for their ongoing cooperation and support. Merci beaucoup.
Well, merci beaucoup, Chief. Before we get started, I'd like to remind those who are calling in to ask a question to please make sure you mute or turn down the volume of your TV or computer before you ask your question. Otherwise, there will be an echo and we won't be able to hear you. If your question has been asked by someone else, please consider asking a different question or let someone else ask a question. We have both written questions and now I believe we're going to start getting phone calls coming in. To call in your question, if you haven't already, dial 613-233-1979. Passcode is 5490123, and then press *1. Le numéro est 613.
So the number is 613-233-1979, passcode 5490123, and then press *1.
Should also be listed on the screen, and Patrick, who is our bell operator, will now take questions from the phone line, so please connect through them. So I think we have our first question. If you'd like to give us your name and what your question is, please.
Thank you. Merci. Please press *1 if you have a question. S'il vous plaît, appuyez sur étoile 1 pour poser une question. The first question is from Roger Dow from Orleans. Please go ahead.
Yes, Mike, I'd like to say thank you to everyone on the panel and thank you to the city for what they're doing for the COVID-19 situation. But I'd like to ask for a security question. Is steam appropriate to disinfect reusable tools for COVID-19? Also, is the city considering asking store owners to take the temperature of people to make sure that people aren't infected as they go back to work?
So we're clear on the first part of the question is reusing, did you say tools?
Yeah, it's, well, the reusing of the mask. If you use steam to clean the mask that you'd like to reuse, is that effective?
Dr. Etches?
Yes, thank you for the question. I appreciate that people are asking about how to use masks appropriately and how to clean them. We are recommending non-medical masks, cloth masks for people who are not healthcare workers. So in the in the healthcare setting, there is still not a large supply for weeks and months of personal protective equipment, and so we do ask that that kind of medical equipment be reserved for healthcare providers and first responders. The reusable masks are meant to be washed, so ideally, every time you use them, or each time you take them off, if they're soiled, you put them in your laundry, and you can wash them along with regular detergent with your clothes. The idea then may be that you need more than one mask if you're going to go out more than once a day or come into close contact, that is, with people more than once a day. We have a lot of detail about how to use masks properly on the Ottawa Public Health website. Il y a beaucoup d'informations concernant l'utilisation des masques.
Yeah, there's a lot of information on ottawapublichealth.ca on how to wear and care for a mask.
Yeah, I was just going to ask Councillor Eglai, when I put on the mask, because I wear glasses, it steams up, and he's actually found someplace, I think in Nepean, Keith, that has a product that you can put on your glasses if you wear glasses and want to wear a mask.
Yes, that's correct. The product is oddly called Cat Crap, and it's available at Merivale Optical. And they can provide that to you. There may be other sources in the city as well, and it seems to work quite well.
Okay, it's good news, good advice. We have a written question here. Is there a hard date when the city is forced to make a decision with regards to summer camps and programming? Steve Kanalakis, this has got a lot of people concerned. My understanding is there's about 10,000 kids have already registered, and they'd like to go to camp.
No, thank you, Mayor. The city normally launches its camps right at the beginning of July is when we kick things off, and normally we're very busy preparing for those camps, hiring all our summer students, etc. So right now, our view is that if we know before the end of May, there still is a possibility we'll be able to kick off those camps. If we don't know by the end of May, we might have to push the start of those camps a little deeper into July. But there will be restrictions on those camps. There won't be as many children allowed in the camp, most likely. We're probably going to be taking the same kinds of measures emergency child care centers are taking, where there might only be fewer kids, they might be separated, there might be other protocols in place. So we're trying to figure all that out right now, and we'll be working in consultation, obviously, with Ottawa Public Health, and we'll have more to say once we hear more from the province as they roll out their reopening of our community. So we're hard at work looking at that and to be ready in the event that day comes.
Okay, thank you, merci. Next, Patrick, I believe we have another caller.
The next question is from Helen Apochtin from Centertown of Ottawa. Please go ahead.
Yes, I wanted some clarification for Dr. Etches. In terms of the rules and guidelines for single people who live alone and go outside, if they meet with anyone, like let's say they're going for a walk or just outside their yard, if they meet less than 5 people, does it have to be in their private household? Because if they don't have a private household, that means they can't meet anybody. So I just wanted to clarify that, because there seems to be contradictory information about that.
Sure, I'll speak to part of that, and I think maybe those in charge of enforcement of the provincial emergency order could also speak to the question of the number 5. So the advice to everyone, whether you're in a household of 1 or in a household of 6 or 8, is that ideally we would limit our contact with people outside of our household. It's advice. It's good advice so that you don't encounter infection in the community. And the reality is many people need to go out to work. You're going to encounter other people. Other people have mental health needs. They need to get support. So it's as much as possible to limit to your household. We are hoping that we can open that up further. But every time we open up our interaction to others, bringing them into our bubble, we say, of 2 meters of distance from others, there is the risk that we encounter the virus because people have asymptomatic infections. They can be infected and not know it. I mean, it's why we give ourselves distance between others so that we don't pass it on unknowingly. So that is not law, I guess, in terms of the provincial order. Somebody else want to speak to that?
I can take that. Okay. So I think the basis of the discussion that you're identifying is you're at home alone, you live in a single household. Dr. Etch's advice, I think, is the prime element about, you are risking when you're talking to others, so keep your distance, wear a mask, etc. With regards to the 5 number, it is defined, so groups of more than 5 do raise suspicion, or there could be complaints and we could intervene. We would normally always intervene and give guidance and ask people to move on if they're bigger than groups of 5. So yes, the question of being part of the same household arises there, but again, there is a guideline, there is judgment that's required. There can be groups of people in the same household that are sick, so we're not obviously going to intervene there. But I think more importantly, the group of 5 is just a number to give people an understanding that we shouldn't be in big groups while COVID is part of our reality in our community. And most importantly, I think it's the health question with regards to that. So I would heed Dr. Etch's advice, try to limit those opportunities, and yet at the same time you need human interaction. I understand what you're describing, but stay your distance from others. And if you're in a group of 5, as long as you're a good distance, but you are risking, as Dr. Etch has said.
Okay, merci beaucoup, and thank you, Helen, for that question. We'll go back to the phone lines, and Patrick, you have another call for us.
Thank you, merci. The next question is from Trevor Ashe from Canada South. Please go ahead.
Hello, good afternoon. I have a question about the equity and inclusion lens, and specifically with regard to the application of that lens, which is supposed to be applied to all the city's decision-making when it comes to giving people fines for sitting on a piece of grass in a park that goes beyond actually what the province restricted. I know that the city decided to remove some of those restrictions, which was great, thanks to a lot of community members and organizations encouraging the city to allow people in parks. But I'm worried about people who are under financial hardship, who have been given an $880 fine and are basically already living in poverty. They don't have the benefit of a weekly salary that people answering this question do. Can any exceptions be made to address the inequities of the application of that, and specifically for people facing real financial hardship? And then the second part of my question is with regard to building back better. Groups like the World Bank and the World Economic Forum and urban design consultancies like Alta Planning are encouraging cities to build back better with tactical urbanism. And we're not really seeing that in Ottawa as much as many community members would like to see. So I'm just wondering if more progress could please be made to open up streets for people to bike. I know the NCC just recently made an announcement, but it seems all we're seeing in Ottawa is roadblocks when other cities around the world are really making tremendous progress on opening streets to people and allowing people to bike safely. So that's my two-part question.
We'll ask Anthony DeMonte on the enforcement and handing out fines.
Certainly, Mayor. As this event evolved, certainly the objective and the tool of enforcement that the province provided to municipalities under the Emergency Management Act of Ontario, its objective was to use sparingly. And the numbers indicate that that's exactly what the city did. We've had approximately 5,000 requests from citizens to respond to calls, and yet and the vast majority verbal warnings were given or information was given to individuals, and only 117 tickets were given. And what's important in 117, and I don't have the data in front of me, many of those weren't to individuals. They were the businesses that were not following the orders. And we have to remember we started in a crisis. And as that crisis and things now, when we're now at a point in time because of the work of everybody in the community respecting things, we're able to loosen and start moving to some semblance of normality. So we're moving towards that. So, you know, less than 2% of people, unfortunately, did not follow provincial orders and were given a ticket. And many of those, after several warnings, were returning. So there was no issue about over-enforcement with regards to that. Yes, you talk about a lens of capability to pay, but one understands that when you're on the ground, a bylaw officer intervening with an individual who is not following the direction of the order, and after people have been warned second or third time, ultimately does enforcement. So that's the first part of the answer, the first part of the question. The second, I'll have to defer to the mayor, to who he wants to pass that to.
Yeah, we have members of council and staff certainly have the ability to bring forward suggestions for road closures. I know where I live, Councillor Jeff Leeper successfully closed down a section of Byron, and closer to my home in Councillor Kavanaugh's ward, she did the same thing on another section of Byron, and we did the same with the Bank Street Bridge, and I believe Councillor McKenney has a section of Somerset. So those areas where there are pinch points, there's a process in place that councillors can follow. So I think we have a question, a written question now, if I'm not mistaken. Dr. Etches, people want to know why kids can't use play equipment and swings and teeter-totters. They can go to the open spaces, but they don't understand why we should not allow kids to play on the playground equipment. Can you give an answer to that, please?
The simple answer is that it's illegal right now under a provincial order that people are not to use the amenities in the parks. However, I think the rationale for that order probably relates to the difficulty in cleaning surfaces where young children may be spreading their snot around, you know, to just say what it is. The children in our community have been relatively unaffected, that we see through our testing. Children between 0 and 15 have been the age group with the least amount of testing, but it doesn't mean that they're not infected. When we look around the world, and other countries that have done studies show that probably children are affected as much as middle-aged people and their parents, but they don't get severe illness as often, and so it doesn't show up as much in the numbers. So I think that rationale that we need to protect the transmission of the virus through structures that can't be cleaned and protect spread among children is there. You know, as the prevalence of the virus decreases in our community, and we're learning more about the virus, that it doesn't maybe survive outside as long, you know, these are things that help give us reassurance to move ahead and change things, but that is under the provincial order.
Okay, merci. Patrick, we have another call in the queue, please.
Thank you, merci. The next question is from Philippe Turcotte from Ottawa Vanier. Please go ahead.
Bon après-midi à tous.
Good afternoon, all. I wanted to thank you all for your efforts in the community and to ensure our safety. Transpo, as you know, is the adapted transportation service for disabled people and seniors in the city of Ottawa. Therefore, these are people that are very vulnerable to COVID-19. Transpo is an essential service which required that many passengers share the same car on one trip. So I'd like to know what is Transpo doing for the safety of its passengers now, because physical distancing is not possible. Is the question for On Paratranspo or OC Transpo? Well, I think that we have a new policy that says that there's only one passenger per car, Paratranspo car. There's not two or three other people. Isn't that right, Mr. Kanellakis or Tony? We know that the seniors or disabled people are vulnerable, so we've changed the policy. Now it's one person per car. Would you like to add something, Mr. Kanellakis? You're right, Mr. Mayor. That's the new policy now. There'll be a meeting of the Transit Board in June with Chair Alan Hubley, and there'll be more details to answer the questions on social distancing with on Paratranspo and OC Transpo. So there will most likely be a presentation made by Mr. Manconi on this issue. And thank you, Philip, for this question.
Alors, je pense I think there's another question. Il y a une autre question, Patrick?
The next question is from Nicola Arnoni from Ward 9. Please go ahead.
Yes, hi there. The question is for Mr. DeMonte. Now that the Premier has said okay to tennis courts, we have 200 courts, public courts in the city of Ottawa. When will the nets go up? And private membership courts like the Rideau Sports Club, can they be putting up their own nets ready to go for kids and players? If you can address that, please, Mr. DeMonte.
Mr. Mayor, I'll take the question. I was just speaking with Mr. Chenier, who's the General Manager of Parks, Recreation, Culture and Facilities. They're meeting, as a matter of fact, right now with the team to look at when they can open that up. The tennis courts wouldn't open under the province's direction that was announced this afternoon until Tuesday, midnight Tuesday. So we're looking at what are we going to do in terms of opening up the tennis courts in particular, get the nets up. It's normally a 2-week process to hit all the tennis courts across the city. We're looking to accelerate that. We're responding to news that we just found out several hours ago that people will be able to play tennis, but and we need some more clarification for the province, because as it was reported from what we saw from the news release and listening to the Premier, it still is individual sports where people are basically, tennis is allowed, where you can have 2 players on opposite sides of nets, still respecting the social distancing. But having spectators, having tournaments, having group gatherings are still not permitted under what the Premier announced today. And that's the same case with our sports fields, where people will be able to enter our sports fields as of tomorrow, because they're normally closed during the spring season to protect them from the rain and not to damage the fields, so they can be sustained through the whole season. But people can start using sports fields, but again, not breaching the provincial order around the number of people that can gather, and not having organized sports, and not having spectators gathering to watch people play on the sports fields.
Yeah, I think that's a good point, because we had a number of people who said, well, there are these empty sports fields that are just sitting there and they're not allowed to use them. Now they will be allowed to use them, but not through organized sports, just, you and your, son or daughter kicking a football or soccer ball or tossing a frisbee on those fields. So I think we have many more questions. We'll go back to the phone lines. Patrick, s'il vous plaît.
Thank you, merci. The next question is from Mac Dong from Canada. Please go ahead.
Hello, my name is Mike Brown, and I have a question for all of you. It's regarding the use of chemicals. According to a report from Health Canada, it says that many children can have allergic reactions to prolonged exposure to chemicals. Will you guys continue to use chemicals and put our children in danger?
I'm sorry, I understand the last part of the question.
The last one is, will you guys continue to use chemicals to disinfect and kill the virus and put the lives of our children in danger?
So I think that the question is about the use of chemicals. Chemicals is a broad category of products. So what Ottawa Public Health recommends for cleaning surfaces, for cleaning clothes is nothing out of the ordinary compared to your typical household products. You wash your hands with soap and water, use alcohol-based hand sanitizer. So we haven't had to use any stronger chemicals in cleaning or recommend that for dealing with this virus. The city has increased its cleaning practices in areas where there might be, they're looking at what to do as people come back into receiving services. But again, these are not anything, no products out of the ordinary. I don't know if that answers the question.
Okay, thank you. We'll go back to the phone lines. Patrick, please.
The next question is from Hubert Ezekiel from Ottawa. Please go ahead.
Bonjour. J'aimerais d'abord remercier.
Hello. First of all, I'd like to thank the City of Ottawa for everything it's done since the start of the pandemic. My question is mainly for the health services representatives. What are the risks for people using a testing center or those using a clinic for medical reasons? What steps have been taken to avoid contamination? Measures to avoid contamination of healthcare workers and clients alike. I think your question deals with the steps taken in testing centers and in clinics, right? In clinics and testing centers where people go to get tested for COVID-19. Well, these centers are administered by the hospitals. Now, their practices are the same as in hospitals. They protect employees, they protect patients alike. So they use clean equipment, covers, gowns, masks as they need them. We have confidence in their practices. There's also physical distancing, which is required in these centers. It's very well organized. I've seen the system in action myself. I would recommend that you go to one of these centers to get tested if you have symptoms. Because if you test positive, we can help you with the process of contact tracing and stop the transmission and the spread in our communities. Thank you very much.
The phone lines, please, Patrick.
The next question is from Sarah Johnson from downtown Ottawa. Please go ahead.
I would like to thank the panel for taking their time to answer our questions. My question is in regards to elementary schools reopening. In the case of a student that would have contracted COVID-19, what would be the steps that would be taken surrounding the situation?
Dr. Etches.
Yes, so we do not have elementary schools open in Ontario yet. That will be a provincial decision. We know that our friends across the river have started to return to school in a new way, and I'm in contact with them. So the kinds of things that they're putting in place make a lot of sense. What they are doing is they're making sure that they screen every student and every teacher, every employee who comes in to clean to make sure that people do not come into the school environment with a fever or a cough or any symptoms of illness. If someone was to be identified as ill, they would be sent home or recommend that they go for testing. If a child is identified to have COVID-19 infection and they've been in the school environment, the public health work is to then identify who's been in close contact with that student. So who's been within 2 meters, for a period of time. And so the way the schools are opening, and I imagine it would they'll be looking at similar things if that happens here. It's to limit the number of contacts that students have or teachers have, so the follow-up wouldn't have to be with a whole school necessarily. So I think that the idea is the same as other cases. You want to stop transmission in the environment.
Okay, thank you. We have a written question. Chief Slowly, can you speak to what the Ottawa Police Service is doing to address violence against women, and maybe talk about, unfortunately, some of the trends that are going in the wrong direction with respect to violence against women in our community?
Thank you, Mayor. And it's an important question. Thank you. We have to be very aware of our most vulnerable and marginalized communities, and violence against women is one that touches every community, every neighborhood and every community. On April 14th, the Ottawa Coalition to End Violence Against Women, Crime Prevention Ottawa, Interval House of Ottawa, and the Eastern Ottawa Resource Centre launched Unsafe at Home Ottawa to offer women living with abuse or violence during COVID-19 a safe space to reach out for help. Unsafe at Home Ottawa is a secure text and online chat service for women who may be living through increased violence and abuse at home during this pandemic. Counselors provide emotional support, practical advice, and referrals. In addition to that, in March, Ottawa Police expressed concerns that our 911 calls regarding domestic abuse were down. We know that abuse, isolation, and control are still happening, and were still happening during those early days of the pandemic. It just wasn't being reported as much as we would like and as much as people needed. So with that assistance of our partners, with the focus on public education and engagement, we are now seeing our 911 calls for domestic arguments are going up. Again, it's not anything to celebrate, but it's a better and more healthier place where we're seeing people willing to come forward on different platforms to come forward to calling us or to the other agencies that can help. We're asking the public to use your eyes and ears to help your neighbors and other vulnerable people. If you see domestic abuse or what appears to be domestic abuse of any kind, please do call the police. If you're not comfortable calling 911, you can contact unsafehomeottawa.ca, and they will take appropriate steps. This is about getting the help and support to the women and children who need our help and who suffer from abuse. Thank you, Mayor.
Great, thank you, Chief. We'll go back to the phones. Patrick?
Thank you, merci. The next question is from Andrew Smythe from Lapine. Please go ahead.
Yes, sir. On Monday on Radio Canada, the return of students was described as a laboratory phase. And keep in mind that the measure currently used in the spraying of children with lots of chemicals such as bleach in schools. So I would like to know, do you intend to make the same mistake as Quebec City and expose the children to so many dangerous and harmful chemicals?
Yeah, that, unfortunately, I don't think we have the answer for you, because that is controlled by the school boards. They're a separate elected group of individuals. I would suggest that you perhaps contact your school trustee to seek information. Obviously, as Dr. Etch has pointed out, there is great liaison between what's going on across the river and our system, so that we can learn from any mistakes or errors or missteps that they've made, so that we don't repeat them on this side. But at the end of the day, the province, as you know, will be the ones that will determine when a school is coming back and what conditions have to be met in terms of social distancing and activities such as, you know, gym class and eating in the lunchroom and so on. So I'm sorry we don't have someone from the school board to answer that, but you should probably contact your school trustee. So I think we have time for one more written question. Thank you for people for emailing them in. We've got a couple dozen here. Let me just see here. When can we continue to receive questions regarding gatherings? Can I have friends over for dinner? And we heard a lot about this during Easter, Dr. Etches. Could you tell us what your interpretation of the rules are to allow people to come for a family dinner, even though they're not in the same household? They may have a brother or sister who lives in a different part of the city, but they want to come for this long weekend for a barbecue. Is that recommended or permitted?
I think The important thing here is that everybody wants to protect each other from infection, and everybody wants the infection in our community to decrease. And what we have been doing by physically distancing has helped. That's made a big difference in avoiding what we've seen in some other large cities. And so physically distancing is possible with family members if they come for a visit. It's possible if they keep the 2 meters away. You know, it depends what kind of activities you're undertaking. It's not ideal. The best advice I have is to try to limit your activities to your household. But we know we're in a time where people have been isolated for a long time, and it's starting to take a toll. And so we do recognize that people also need social supports. I just want to encourage all of us as a community that we need to continue this thinking about how the virus could be out there in any interaction, because we haven't eliminated it. You know, our hospitalizations are actually very stable, which suggests the infection in our community is stable. It's not rapidly declining. And as we go about increasing more activity, that's not going to make the infection decline. That's going to make the infection rise unless we do our part to continue to keep 2 meters away from others.
That's good advice. Thank you. So we have time to one last question, if we can be brief so we don't run over time on Rogers. Patrick, go ahead, please.
The next question will be from Helen Apelstein from Centertown of Ottawa. Please go ahead.
Oops. Hello, Helen.
Yes, hello. Thank you very much for taking a second question. I just wanted to clarify that about with the opening, the slowly reopening, in regards to healthcare, and I know that this is kind of related to the province. Does this mean in the first phase that doctors' offices and physiotherapists will open? Because there was talk about healthcare settings and scheduled surgeries and counseling, psychological and addictions counseling, but really doctors' offices and physiotherapists, will they be opening at that stage?
Many doctors' offices are open right now, and I would encourage people to call their family doctor's office if you do need health care. They are seeing people virtually, they're talking to people over the phone, and their offices are often open. So I think people should continue to try that avenue of reaching out to their family physicians. It may well be that more and more start to get back to work if they have closed, and that's an important support. You know, whenever you have an urgent health care need, please don't hesitate to reach out and get help. And especially if you have shortness of breath or chest pain or difficulty breathing, these are emergencies that you should also continue to seek help through the emergency system.
Great, thank you. I'm sorry we're not able to get to everyone's call or written question, but thank you very much for participating in our second virtual town hall meeting. Thank you to the panelists and the members of the public who called in. We hope this has been helpful. Merci pour votre participation et merci à mes collègues.
Thanks for your participation, and to thank my colleagues here at the City for their participation.
Ask your question. I remind you that you can call 311. The City's website also has a lot of information, ottawa.ca, and of course Ottawa Public Health's website is chock full of great information and some of the frequently asked questions. And if you missed any of today's town hall, a replay will be available on the City of Ottawa's YouTube channel. I wish you all a very happy and safe Victoria weekend. Of course, thank you to Queen Victoria for choosing Ottawa as the capital of our country. And stay connected, but stay 2 meters apart. Thank you. Merci.